Hi, I'm Dr. Govind Nandakumar. I'm a gastrointestinal surgeon at Manipal Hospitals, Bangalore. Today we'll talk about surgery for anorectal disorders. I want to give you a sense of what you may experience before, during and after surgery. Let's talk about fistula surgery. Fistulae are abnormal communications that develop in the anal canal, which could lead to an abscess. Generally, patients present with bleeding and discomfort in the anal area, sometimes some discharge. Our usual examination will require that we do a finger exam, then we may examine you with a scope. After that, we may ask for either an MRI or what's called a transrectal ultrasound. Once a fistula is identified, we would characterize the fistula, and what the main thing you need to understand is to understand the extent of muscle involvement with the fistula. There are two muscles in your anal canal, the internal sphincter and the external sphincter, and we map out the trajectory of the fistula through the sphincter, and our goal is to get the fistula to heal without damaging your external sphincter. The internal sphincter often needs to be divided and can be done so with little change in your ability to control solid bowel movements. So once you get the imaging, we would sit down and speak about what specific procedure would be relevant to you. Please do not get distracted by catchphrases like laser, glues or plugs. None of these have been shown to be effective. We used evidence-based methods such as a fistulotomy, a fistulectomy at times, and sometimes a seton. A seton is a rubber band that is placed around the muscle to protect the muscle but still heal the fistula. So once you've been diagnosed with a fistula and we've decided to go ahead with the surgery, what must you do to prepare for the surgery? The day before, we may want you to have a light dinner. We usually need you to be fasting for a set amount of time, and the specific timing of fasting will be communicated to you. We may give you an enema to clear your rectum prior to surgery. My coordinators and staff will help you with the admission process. They will coordinate the date of surgery with you prior to fixing the surgery. Our financial counselor will help you get your insurance approval done if required, and the admission team will help you with the admission process. Please remember that it is normal to be anxious before surgery, and you do not need to panic about that. Prior to the surgical day, you would have met with the anesthesia team to do what is called a pre-anesthesia checkup, wherein the anesthesia team will help you optimize your health for the surgery. They will evaluate your other medical problems and advise you on pain management before surgery. Anal surgery can be done either under general anesthesia or under regional or spinal anesthesia, and the anesthesia team will help you choose which one may be better suited for your particular condition. On the day of surgery, my team members will escort you into the operating room, and you will be positioned and you will lay down in the operating table, after which the anesthesia team will prepare you for surgery. During the operation, let me assure you that you will not feel any discomfort, as the anesthetic methods are well advanced now.